Kahlua presented to us on emergency after some unwitnessed trauma when she was outside, presumably hit by a car, and she was obviously injured and having trouble breathing. So on initial exam, her heart rate was elevated, her breathing rate was elevated and abnormal, it was labored. Ultimately doing some diagnostics, we did x-rays of her chest, which showed a diaphragmatic hernia. So basically abdominal organs were moved up into her chest cavity through a tear in the diaphragm. So to fix that, she needed some initial stabilization and then ultimately be taken to emergency surgery to correct that so that she could get breathing properly again.
The operating room, we find, unfortunately, she had a cardiac arrest. We made a decision to do an emergency CPR through a surgical window that we were going to create to repair the hernia. So we did that, and we were able to do cardiac massage. And after a few moments of disbelief, we both recognized that there was contraction and a pulse, and her heart started amazingly after 12 full minutes of CPR.
After Kahlua's arrest, she definitely had some complications of the arrest itself. She had regurgitation and diarrhea secondary to poor perfusion to her gastrointestinal tract. We suspected she got aspiration pneumonia secondary to that regurgitation. She ended up with temporary arrhythmia that needed to be monitored and managed. She ended up with some temporary neurological compromise that we had to manage and make sure things didn't go south in that regard. She needed a feeding tube as she required a lot of nutritional support, and being neurologically compromised, she wasn't going to eat yet. Really all of this stuff combined in making sure none of these things deteriorated to a point of causing things to go south really took a lot of intensive monitoring, lots of frequent blood work and diagnostics and so forth, and a whole lot of manpower and virtually everyone in the hospital involved in her care.
You know, throughout the night and the day after surgery, we really weren't sure if she was going to make it. Only about 6% of patients who go through an arrest actually make it through to discharge. We had to have a lot of different departments putting their heads together to help Kahlua out. So she saw the neurology department because of some of her neurologic abnormalities like her seizures. And she also saw the ophthalmology department because she had a cortical blindness that we discovered the day after surgery.
Cortical blindness is where the area of the brain that interprets vision is not functioning properly. So it is diagnosed based upon the fact that the ocular exam is normal. And when you do the neuro-ophthalmic examination, so the examination of the nervous system as well as the ophthalmic exam, shows that everything is normal other than the fact that the patient is non-visual.
Little by little, every day, we started to have more and more hope for Kahlua. So on day 3 or 4, we noticed that she was starting to try to sit up by herself in her crib. And that was so heartwarming to see. On day 10, we were all so happy to see Kahlua go home. That's really why we do what we do, because dogs come in on death's door, and being able to see them go home wagging their tails is just so heartwarming. And to see her reaction when she saw her family, saw her leash, and knew she was going home was just so amazing.
Kahlua's case usually reminds me that there's hope for all of the other critical patients. When you're doing CPR on a patient that you don't really think is going to make it, we also had a time when we didn't think Kahlua was going to make it. It just reminds you to give your all to all of the patients.
I can't even begin to count how many people, individuals, would have been involved in caring for her. And even with a case that, on paper had a poor prognosis, but at the end of the day had an excellent outcome with no long-term consequences. That's what this hospital is all about.